The broadcast is now starting. All attendees are in listen-only mode.
Extend a good morning to our viewing audience, and I'd just like to thank you for all that you're doing to remain safe and all that you're doing to get trusted information out to our community. I will start by what I've been doing all throughout the pandemic, which is urging our residents to double down on the 3 W's. And we certainly want you to stay home as much as possible. We want you to definitely wear a mask when you go out, practice social distancing, remaining 6 feet apart at every turn, every opportunity. And I'd also like to add that we also should try to avoid large gatherings. While we are fortunate to have the vaccine, we still need to adhere to these public health mitigation measures to remain safe. So we certainly want to continue to encourage that. At present, we continue to see the effects of holiday travel and Christmas gatherings. We have not yet seen the effects of New Year's Eve activities and travel that went along with that. So as I've reported previously, the next 4 to 6 weeks are definitely going to be critical in our mitigation of the current surge. I'd also be remiss if I not say that I appreciate the patience of our residents in the midst of the pandemic. With this life-saving vaccine within reach, it is easy to see and feel the fervent desires of our residents to get the vaccine. And I also acknowledge for a fact right now that demand now far exceeds supply. And I'm still confident in saying that everyone who desires to get the vaccine will receive their shot. Sorry for that brief pause. Durham is fortunate to have both vaccines in supply. We have also fortunate to have received an ultra cold storage freezer through our partnership with North Carolina Central University's Accord program, and that was free of charge, and we are certainly appreciative of that in Durham. At present, we did receive our initial shipment on December 21st of 3,200 doses of Moderna. We have transferred 500 doses to our community partners who are considered to be eligible providers. We do have 1,890 doses on hand, and we also have Pfizer. I will indicate that we did receive 2 shipments in the same week, last week. So that gives us 3,900 doses that we will begin to administer, or we have begun administering today. And I will also note that, again, you know, that was delayed due to our newfound ability to store the ultra cold necessary requirements for the Pfizer vaccine. This time I will address the questions that we received previously. And the first question that we received was, other counties are in phase 1B. Is Durham behind other counties, and why? What would make the process go faster? Is it staffing issues? And just want to make sure I get this question right. Okay, is it staffing issues? The simple answer is my staff needed more time. We are committed to ensuring that we do what is right for our citizens. They deserve nothing but the best. Of course, Durham is the city of medicine and has a large population that fell into phase 1A. We thought it not robbery to take the time to ensure that we vaccinated this group correctly. I truly believe that doing the right thing is always important, and I am sure that other counties did face similar hurdles. I don't necessarily consider Durham to be behind, as I've also addressed in my weekly update, that there's a number of things that really allow counties to pivot, if you will. And of course, vaccine supply is the most important thing. In addition to, size of the county, in addition to staffing and other things that are necessary to make sure that we are able to pivot to the next phase in a smooth manner. Of course, what would make it go faster? I will acknowledge that there were a few bottlenecks in our rollout. The COVID vaccine management system has been a challenge. This has led us to utilize paper forms at times, and it has reduced our ability to move individuals through the entire vaccination process in a timely manner. At best, I will say that it probably requires 30 minutes from start to finish for individuals to go through the entire vaccination process. Of course, that is also required for social distancing and in making sure that, per the guidelines, that we're able to observe individuals for 15 to 30 minutes after they have been vaccinated. Another challenge with a large group of 1A participants includes, the scheduling of these individuals. So we have certainly gone through and painstakingly ensured that the medical offices that are part of phase 1A recipients have been addressed. And we have greatly increased our scheduled staffing. And I am most confident that we will continue to go through phase 1A. Staffing always presents a challenge, even during normal times. So I'm confident in saying it has not presented that much of a challenge. Again, we have increased our staffing through available internal resources, and we've also requested external resources that I'm happy to say is coming from North Carolina Public Health Preparedness and Response and different staffing agencies. So I do believe that we're good, and we're definitely trending in the right area. The second question I received was, when does the health department expect to begin vaccinating the next phase, and how will people in this phase be scheduled? When will appointment scheduling begin? We will begin vaccinating phase 1B on January 19, 2021, and it will be by appointment only. We will not accept walk-ins at this time. And again, it is for the purposes of making sure that we do it safe and effectively. Scheduling will be done through a self-service scheduling app along with a dedicated phone line. We will publish this information later on this week, and I will provide more information in my weekly address to Durham County. That's normally done every Friday and published by Friday afternoon. Having heard about other counties' entire phone systems shutting down as a result of a heavy influx of calls and being overwhelmed by callers, we just took more time to ensure that it does not happen to Durham. And as mentioned previously, more information will be available later on this week, but that is currently what we're planning on doing. The next question, why has Durham administered so few of the vaccines it has received? How many vaccines do you have in the freezers currently? I do believe that I addressed this in the previous opening statement, and I'll move to the next question. Where will vaccines be available for phase 1B? The health department, Duke, or somewhere else? At present, the vaccines will be available at both the health department and Duke. We are encouraging and are encouraged by the number of community providers who are enrolling with the North Carolina Department of Health and Human Services in order to be eligible providers that can administer the vaccine. This is a slow process that does require some training on the COVID vaccine management system. And again, every day, every week gets a little bit better. So we're looking forward to the day when more community providers are able and eligible to provide the vaccine. The next question is, how would you say vaccinations have been going in Durham, and what do you think can be improved? In short, I would just say the task before us can be seen as a mountain that has to be moved. And I certainly have faith in my staff who've been working around the clock in our ability to move this mountain. There is always room for improvement, and I'm confident that we will be successful. The challenges indicated earlier, the different bottlenecks, we are working with the state to improve our workflow with the COVID vaccine management system. And we're certainly thankful for that partnership with the state, but we're even more thankful for our work with our community partners. We have a number of initiatives that are currently being planned and will soon be operationalized to provide more ways and more locations for our residents to receive their vaccine. Time was simply needed to coordinate and still needed to coordinate these activities to make sure that they're safe and they are able to be in locations where our residents can readily make themselves available for vaccination. The next question is, how long do you think it will take to get through phase 1B, group 1, before moving to other groups? And I will say it's hard to say. Phase 1B is a diverse mix of people. I'm confident that the planning that is ongoing and certainly will assist in our ability to be nimble yet safe in our vaccination process. For the listening audience, just know that phase 1B does include adults 75 years of age and older and frontline essential workers. To be more specific, group 1 is those who are 75 years of age and older. There are seniors, members of our Durham County. And group 2, healthcare workers and frontline essential workers, 50 years of age and older. And finally, phase 1B, group 3, are healthcare workers and frontline essential workers of any age. As you would imagine, that is still a very, very large group to get through. But again, our planning and our careful and methodical approach to ensuring that we do it the right way will garner us success. How many more people are left in 1A is the next question, followed by, will you continue these vaccinations while starting 1B? As mentioned earlier, Durham is the city of medicine. There's a lot of individuals who are considered to be those who are frontline workers, most at risk. And we have been taking our time to make sure that we go through this list, and it continues to grow. The second part of the question, will you continue to vaccinate? This will be a blended phase. We will be in 1A as we continue to be in 1A and continue our work with 1A as we move toward starting 1B. But again, staffing and all the assets and resources are in place to be successful. The next question, what timeline can people expect in groups 2, 3, and 4? Phase 1 will certainly last throughout the winter season. I am most hopeful that we will be in phase 2 by the spring, which will more than likely be mid-March, with the remaining phases to take place in the summer, those remaining phases being phase. The next question was, how much will vaccine cost to get? And as probably been reported several times, the vaccine is free, and that is coming per the directive of the federal government. And the final question I have is, when will people receive their second dose? As far as my knowledge, Duke has began to provide second dose shots. Those people who were vaccinated at the health department will begin to receive their second dose or second shot next week. that concludes the questions that we have received thus far. And I do believe we have a little bit more time to answer some additional questions.
Would you like
Another
any
question?
mics unmuted?
No, ma'am. I am. Thank you so much. I'm receiving the question. Another question we received is, why are 75 plus scheduled to be the start of phase 1B instead of essential workers? Unfortunately, I will say that that is been that schedule, if you will, has been designated by the federal government, particularly the ACIP and the CDC, and that is also a part of North Carolina Department of Health and Human Services vaccination plan. I don't necessarily have the answer for that, unfortunately, but we have been committed to following that vaccination schedule. The next question we receive is, how many people from the Durham community need to be vaccinated? That's a tough question to answer. I will say that, you know, again, Durham is a community of anywhere from 320,000 to 330,000 individuals. And we are committed to making sure that those who are eligible as deemed by the federal government are able to receive their vaccinations. As we well know, there's still a lot of clinical trial information and work still being done, particularly with those individuals who are under the age of 16. So when the information becomes available as far as opening, you know, additional populations for vaccination, we will address that accordingly. The next question I received was, are you seeing higher demand for seniors 75 plus than you saw for participants in phase 1A? In my humble opinion, the answer is no. Phase 1A was those people who are most at risk, and that is our healthcare workers, that is our emergency personnel and our frontline workers who are really doing the work of COVID-19 COVID-19 testing, and are in direct contact with, possible contact with the COVID-19 patients. So as you would imagine, with a pandemic coming close to a year, there's a lot of individuals in this phase as deemed necessary by the CDC and ACIP. So, you know, the demand for them was extremely great, and we have certainly received a number of different phone calls and requests from different healthcare organizations to get vaccinated. The next question I received, given the new guidelines from the White House announced today, will Durham move to allowing anyone below 65 to take the vaccine with a comorbidity? In the spirit of honesty and transparency, I will say that we have not been privy to that information as of yet. We've not received any information from the state, state being North Carolina Department of Health and Human Services, about the change to this vaccination strategy. And we look forward to receiving more information on this. The next question that just came in, some 75 plus years of age and medical workers are eager to get their vaccines, which are on the shelf at the health department now. What is Mr. Jenkins's message to them? I will say that I'm still grateful for your patience. I will say that we have heard from our community of seniors who we value very much. I will say that we will certainly we're certainly working around the clock to ensure that we have a safe process. We have had a soft launch, if you will, in our partnership with the North Carolina Department of Health and Human Services via a public service announcement campaign. That was last week. We had a number of seniors, 75 years of age and older, to come to the health department to receive their vaccines. And the response was favorable as far as their experience is concerned. And we certainly want that experience to be, extended to you as well. As far as essential workers and everything, we have heard from you prior to getting the vaccine, and we are committed to making sure that you are front and center when your time is available, which will be very, very soon. And we beg your patience, and we're thankful for your patience. I will say that I have been made aware that some people were not able to see, and I do apologize for the technical difficulties and technical issues. Again, as a part of our strategy, we are pivoting to some additional weekend hours. And I will just say that, again, we're working around the clock to make sure that we have vaccines available to Durham. And we certainly apologize for any inconveniences that this may have caused. And we know that as our residents are eager to receive their vaccine, we're eager to get it to you. Final words before I just wrap up is, again, as I opened, I just said, again, we're still in the midst of a raging pandemic. I encourage you to double down, if not triple down, on the 3 W's. Continue to wear your mask, continue to wash your hands, continue to practice social distancing. Please avoid large gatherings, and do all that you can to assist us in public health with being safe. To the members of the media, we thank you for your partnership. We thank you for all that you're doing to promote public health in this pandemic. We owe you a debt of gratitude that we'll never be able to pay. With that being said, we thank you for your time and all that you're doing. That concludes my remarks.